10 red flags to send you flying to the dentist. Number 1, halitosis. Halitosis is bad breath. So if you notice that indeed you do have bad breath, then that's reason enough to go to the dentist. There could be many reasons that cause you to have bad breath. The first is obviously coming from the mouth. Either you have a cavity, you have some roots, you're not brushing your tongue. There's also another cause that can give you halitosis. It could be coming from your airway, and the third place that it could be coming from is from your gut. But once you rule out the dental issues, you can be sent to a specialist for the ENT area, or you can be sent to a GIT specialist. Mostly for halitosis, you might not be conscious of your bad breath. It could be your partner who tells you about it, or a good friend. Kindly listen to them. Of course, people who give you positive criticism, not someone who's making fun of you. Bleeding gums is the second reason that would send you flying off to a dentist. So when you're brushing your teeth, are you getting excessive bleeding? And now I'm not talking about the spotting here and there, because what happens when you're brushing, you do tend to prick maybe your gum or your tongue a little bit, and the small spots of blood get mixed up with a lot of saliva and a lot of water. So it's not the blood that is going, it's not the saliva that's going to stain the blood clear. It's the small spots of blood that will make everything look red. So I'm not talking about the small bleeding. I'm talking about copious amounts of blood coming out of your gum or your teeth. So when you're biting into an apple and you realize that you've left blood on the apple, then that's reason enough for you to know that you have a problem with your gums. If you're biting into sugarcane and you leave spots of blood on the sugarcane, then that's also a reason to know that you have a problem and you need to come to the dentist. Most times people tend to bleed a little bit when they are brushing, just a little, but don't be fooled by the amount of red that you see, because most of the times the red gets mixed up with the saliva and the water, and everything just looks pinkish or reddish. But if you're getting unprovoked bleeding, like some people wake up in the morning and they have their gums bleeding, then that's a big reason for you to come to the dentist. If you see brown stains or yellow stains or green stains on your teeth, that is not part of your tooth. That's just food that has hardened on top of your tooth and it's been calcified by saliva. That's what you call tartar. Tartar should be enough reason to send you to a dentist before it gets to another level where you have teeth getting mobile and you losing your teeth. The fourth red flag that you should see, that should send you off to a dentist, is any swelling that you see on your gums or on your tongue or on your lips or on your cheeks. So these swellings can be brought about by trauma. It could be because of pus. It could be something else that would require further investigation. But once you notice there's a swelling in your mouth, please get to a dentist as fast as you can. The fifth red flag is shaking teeth. I mean, one day you wake up and you find some teeth are a little bit loose, or they're moving from side to side. That's not something normal. That means something is going on beneath the level of the gum and it's affecting your bone. So rush to a dentist and get sorted out before it gets worse. If you notice that your tooth has started changing in color, especially your front teeth, maybe you got some small time trauma when you were a bit younger, or you bit into something hard, or maybe you knocked your teeth with a mug, and you begin to notice that there's a tooth that's looking a little bit darker than it normally is. I mean, you're your own best dentist. You see your teeth every single day. So if you notice that there's any change on your teeth, please come to the dentist and let it be addressed by them. It could be a sign of something worse happening. If you notice that there's a change in tooth direction, perhaps your teeth were well aligned when you were younger, but now for some reason you're either developing a gap between your teeth, or there's a tooth that's now twisting, and when you talk you feel like you need to cover your mouth a little bit more, then that is a red flag, and you need to come to the dentist so that we assess whether your bone and your gums are okay, and if there's something that we can do to mitigate that, we'll go ahead and do it. The other red flag that needs to send you to a dentist is a dark spot that appears on your tooth. By a dark spot, I mean, one day your tooth was as clear as this, and then over time you notice that there's a dark area that's appearing on your tooth. So once that dark spot is there, even if there is no pain, don't wait for pain. Even if there is no pain, just come to the dentist and you say, look, my teeth used to be clear, but then now I've noticed that there's some darkening. It could be dark brown, it could be really dark like black, it could look a bit gray. So once you notice that there's a change, then please come to the dentist so that it can be addressed. The earlier you come, the easier the solution is, the less traumatic, and I guess the the more affordable it is. The ninth reason why someone will come to a dentist, and this one is a bit more obvious, is because it will give you some discomfort. If you get sensitivity when you're taking hot drinks, or when you're taking cold food or cold drinks, then that's a reason why you need to come to the dentist, because it's a sign of something deeper happening. So it could be a cavity that has gone beyond the level of the enamel into the dentine and needs to be addressed at that level. The final reason that should send you to a dentist, the biggest red flag, in fact, it's like a red duvet, is pain. If you get pain from any of your oral tissues, please come to the dentist. The pain doesn't need necessarily to come from your teeth. It could be coming from your tongue, the floor of your tongue. It could be coming from your lips. So once you feel pain, please come to the dentist. This would be the first point of check for you. If we assess your mouth, your teeth, your gums, your jaws, and you find that they are okay, then we would send you to the next specialist within the same region. That would be the ENT surgeon, and they would be able to assess, and if there's an issue beyond that level, then they know who to hand it over to.